Medical marijuana tends to be recommended in the healthcare field along with all the positive and negative impacts that come along with it. Medical marijuana is an extract out of the marijuana plant itself. It is known as THC or CBD. It comes along with positive effects as well as negative effects. The positive effects are going to be pain relief, nutrients, appetite, anti-agers, reduced risk of diabetes. It also helps fight people's illnesses. It has been known to treat cancer, diabetes, other things like that. It really depends on the person as to how well this is going to work. The negative effects are going to be paranoia, disorientation, changes in moods, and impaired body movements, causing one to not be able to move the way that they should be able to. We have short-term and positive, negative impacts. The sudden feeling of relaxation. So there is a cannabinoid, which is what they are called, and this chemical is a compound and it floods the brain, and once one inhales the smoke, it'll flood to your blood, and that will cause a sudden feeling of relaxation, calmness, a peace of mind feeling. There's pain that one feels, and when you feel pain, it is your brain communicating to your body that you feel pain in a certain area and why you feel that way. Cannabinoids are a chemical in which are the main reason why people take THC or CBD oil. We have cannabinoid receptors in our cells, and this allows the cannabinoids to connect to our cells, in which cause the brain to realize, oh, we're in pain, but it kind of sends the message to have the pain go away, to take the pain away from that, and which is why most people do use medical marijuana. Medical marijuana will cause sudden impaired behaviors, which is going to be a short-term negative effect of medical marijuana. This can result in depression, suicide thoughts, psychotic episodes, which do happen when people first start taking medical marijuana. It causes hallucinations, things like that. So that is definitely something to keep in mind if you are considering this. There as well is short-term memory loss. When people first start taking medical marijuana, the high level of THC when they're taking this can cause them to have memory loss, short-term, sometimes long-term, depending on how long the person has been taking this. Most of these short-term memory loss does affect adolescents more than it does affect adults. There are some long-term positive effects that have been proven of medical marijuana. Cannabis is an antioxidant, and this means that it is like an antioxidant is going to be like the vitamin C or vitamin E, which is what we know what helps you fight against things. Cannabis is going to be more powerful than that. It has been known to reduce damage that has been done to our cells, and it'll revive them and make them new. We have reduced risk of diabetes. It has been proven and thought to have a greater impact on one's glucose metabolism. When diabetes, the risk factors do overcome the effects of cannabis, so it has been known to also lower fasting insulin levels when it comes to those with diabetes. It has not been proven about type 1, but there has been research on type 2 diabetes. Reports have been proven that medical cannabis has led to inductions of self-reported levels of depression, anxiety, and stress. This has been proven that the one's brain, when you exercise, you feel a sudden relief. And when one feels that after exercising, you feel, peace of mind, your stress is gone, you're feeling good about yourself. The cannabis chemicals work just like these exercise chemicals. When you smoke or you inhale the fumes of this cannabis or the oils, this causes your body to decrease these levels, and you feel, rejuvenized and things like that, how you would feel after exercising. We have some long-term effects of medical marijuana. Permanent loss of memory is a big one that comes along with taking cannabis for a while. It has been taught that, exposure should be cumulative, and over time, the longer you are exposed to cannabis, the more permanent long-term memory loss you may receive. Although it may be beneficial in the moment, it can cause things as dementia, Alzheimer's, things like that, due to the permanent memory loss that is already being put upon your body at such a young age, depending on how you are when you first take this. It has been proven to treat several conditions such as it has been proven that it causes COPD due to when someone smokes tobacco, they are as well introducing themselves to inhalation, to smoke, and just because cannabis has been proven to have positive effects, it as well has negative effects. So you are not out of the blue if you have decided to, introduce yourself to this inhalation. It can still cause COPD. It can still cause lung issues that one should definitely take into consideration. Those who intake cannabis at a young age are as well more susceptible to mental diseases, not just dementia and Alzheimer's. It is due to the cannabis causing delayed brain growth, causing no more brain growth, and so that is really big, especially with children who may be taking this to treat medical conditions, or someone who is a younger teen who is doing that as well. It is definitely something to take into consideration. In conclusion, medical marijuana can both be beneficial and deteriorizing to one's health. Neither positive nor negative impact, they don't really outweigh each other. There are positive and there are negatives. It's really how they work for you, how they work for one's body, but neither positive nor negative outweigh one another.